Measuring your exercise intensity. Aerobic exercise aims to improve your fitness. To get the most of your exercise routine, you must exercise at a moderate intensity for you. Your pulse is the best indicator of how hard you're working. To find your pulse, you can turn your hand so that your wrist is facing up. Put your index and middle finger on the inside part of your wrist, just below your thumb. There's an artery there, and if you put a little bit of pressure, you should be able to feel a pulse. Once you locate your pulse, you want to try and count how many pulsations you feel in a 10-second time frame. The number of beats you get in 10 seconds, you multiply by 6, and you get your number of beats per minute. The reason we only count for 10 seconds is that as you're exercising and you want to stop and quickly check your pulse, if you wait several minutes to count how many beats per minute you get, your pulse is already coming down pretty close to what your resting level is. We want to have an idea of what your pulse is when you're exercising at your moderate intensity. In order to know how high your pulse is increasing by, you need to also check your pulse at rest before you start your exercise. Generally, we're hoping that your pulse will increase 10 to 20 up to 30 beats per minute over your resting pulse when you're exercising. Don't forget that certain medications such as beta blockers can slow down your heart rate both at rest and during exercise. So if you're using generic heart rate charts found in fitness clubs, it's usually basing what your target heart rate should be on your age and gender. It does not know that you're taking certain medication that could affect the rate at which your heart rate is going. So you have to keep that in mind. Another way to measure the intensity of your activity is using the rating of perceived exertion scale. This is a scale based on a 0 to 10 time frame, and you want to rate your effort based on those numbers. Your moderate intensity should feel somewhere between a 3 and a 5 out of 10. We'll have a picture in the slides further down that will explain that a little bit more. The talk test is a very easy way to understand how hard you're working. You should be able to repeat all of the numbers in your phone number in one breath when you're exercising at your moderate intensity. So that includes the area code and the 7 numbers that follows. If you have to stop and catch your breath as you're repeating those numbers, you probably should be slowing down a little bit. There's a lot of gadgets on the market right now that will monitor your heart rate for you. There's watches, there's other system that includes a belt that you wear around your chest that sends the message to a watch that will show you your heart rate. Those are all good tools to use if you feel that you want to know more specifically what your heart rate is at during any activity that you might do. But keep in mind that they can be off a little bit, up or down in terms of how fast your heart is going. So going by how you feel still remains quite important. So if you feel you're working pretty hard and the watch says your heart rate is only at 60 beats per minute, then just keep the pace you're doing at. You don't have to push it anymore. Some general tips for safe exercise. If you have a rescue inhaler, you might want to take it before you start your exercise, if recommended by your physician. This would help to open up the airways and avoid the strong increase in shortness of breath that can sometimes happen when you first start your exercise routine. If you're prescribed supplemental oxygen at home, please use it when you're exercising as well. Don't exercise if you're experiencing significant increase in your shortness of breath or any change in your usual symptoms. Make sure to follow your action plan. Don't exercise when the air quality is very poor, smog, hot, humid. this might make your breathing much more challenging. So make sure you stick to earlier in the morning, later in the evening, so the temperature is a little bit more comfortable. Carry your nitro spray with you and know when and how to use it. If you have angina symptoms, stop and rest for a few minutes before taking your nitro spray. If the symptoms go away, you can resume your exercise, but go at a slower pace. If you have diabetes, make sure to check your blood sugar before and when you end your exercise session. Remember that your blood sugar needs to be at least 5.5 millimoles per liter or higher prior to starting exercise. The reason for this is that exercise will always use up a lot of the sugar that's floating around in your body for energy for the muscles. So that means that your blood sugar level will drop further once you're exercising. Remember that a blood sugar of 5 or higher is required to drive. Here's a little table that can help you with your timetable to measure your heartbeats in 10 seconds. So 10 beats in 10 seconds equals 60 beats per minute. 15 beats in 10 seconds equals 90 beats per minute. So that means that if my resting heart rate is around 60 beats per minute, I'm hoping to increase my heart rate when I'm exercising anywhere between that 13 to 15 beats in 10 seconds. So 78 to 90 beats per minute is kind of my target that I have in mind. Now, don't worry about those numbers specifically. If you go higher and you're feeling fine, there's likely no reason for you to slow things down. It's more in relation to how you're feeling. Are you having any other symptoms? And so on. Here's that rating of perceived exertion scale of 0 to 10. So I highlighted the zone, the safe exercise zone, that is 3 to 5. So a 3 out of 10 should feel moderate, it's comfortable, you can speak in short sentences, you're definitely breathing a little faster than when you're resting, but you can keep going for the amount of time that you set out to do. A 5 out of 10, it's getting a bit difficult. You're definitely breathing harder, you're sweating a little bit more, your sentences are shorter, but you're feeling great and you're just trying to push your limits a little bit. If you're feeling at a 5 out of 10 when you're just starting your exercise session, that means that you need to slow things down. Okay, always listen to your body.